So, this presentation is going to be about breast cancer and breast cancer health. Um, we are Latinas Contra, and we're going to start with uh, first a brief intro of how cancer begins in the first place in any case, and then we're going to talk about some facts about breast cancer. First, we want to just introduce ourselves in case you don't know us. Latinas Contra Cáncer in San Jose is a nonprofit organization established in 2003 to provide cancer education, patient navigation, and psychosocial support to Latino families facing cancer. Our goal is to provide greater access to high quality medical care and connect at a national level to Latino support agencies. So we're going to start talking about how cancer happens in general, how any cancer happens. Basically, every single part of our body is made of cells. These cells are very small and they pack together to create bigger things like our lungs and our heart and our bones. It's like the clothes you wear. You see a shirt or pants, but when you look really close, you notice it's actually made of a bunch of little strings packed closely together. Together, the strings make the shirt, and in the same way, together our cells make our body. In order for us to keep growing or repair ourselves, such as when we get a cut, our cells divide. They replicate everything that's inside them and divide in half multiple times to make more and more cells. In a single day, 2 trillion cells divide in our body. The machinery that makes our cells work and that allows our cells to keep our body functioning is very complicated and it's very, very specific and delicate. A small mistake in the division of a cell can make the cell completely malfunction. And if that bad cell stays in our body, it is going to divide, and those cells will also be bad. Usually, our immune system, will kill a bad cell as soon as possible to prevent it from dividing and making more bad cells. But nothing in the world is perfect, and sometimes our bodies don't recognize when a cell is not working properly. And this is what causes all disease. When cells don't work the way they are supposed to work because of an error, that causes disease. In the case of the disease that we call cancer, the problem with the cell is that it begins to divide uncontrollably. The way our cells know to divide in the first place can be quite difficult to understand, but I think it is very important that we understand it because this is what causes cancer. So basically, there are these guards in our cells that tell the cell it's okay to divide or it's not okay to divide. We aren't ready. In reality, we don't actually have guards in our cells. These guards represent certain genes in our DNA, but I will talk about guards because this is easier to visualize. One of these guards comes from our mom and one from our father. If we lose one guard, it's okay, we can still function because the other guard is still working and keeping everything under control. But when we lose both guards, our cells can't control their division. They don't know when to divide. They can be full of problems, but usually our guards will stop them and say, wait, we can't divide because we are full of problems. But when we don't have our guards, the cells will just divide no matter how bad they are. This is what cancer is. In cancer, our cells will divide and nothing will stop them because those cells lost their guards. And of course, this can happen anywhere in our body because our whole body is made of cells, which is why there are so many different types of cancer. Pancreatic cancer means the cells in our pancreas started dividing uncontrollably. Breast cancer means the cells in our breast started dividing uncontrollably, and so on. Some cancers can be genetic and some usually aren't. The way a cancer is genetic, it doesn't mean that your parents passed you cancer or that you were born with it. It means you are more likely to get it because one of your parents unfortunately passed on to you a little problem. The reason cancer can be genetic is because you were born without one of your guards. This could be because one of your parents lost their guards during their life, or if they were already born without it, so they couldn't pass it on to you. When you're born without one of your guards, you are at a disadvantage already because only one bad thing has to happen for you to lose your other guard. People who are born with both guards have better chances because it is very unlikely to lose both guards during your life. It is more likely to just lose one. And if you just have one, it's still all right. You have the other one. So how can we lose our guards? We can lose them through chance or through environmental factors. This means being exposed in high amounts to radiation, UV light, which comes from the sun, or toxic chemicals. These toxic chemicals can be in our food, such as pesticides used in crops, in waste, in alcohol, in processed foods, in drugs we are given to treat other diseases, in smoke that comes from factories, and in smoke from cigarettes and other drugs. These things can kill our guards, but that doesn't mean that if you eat an apple that isn't organic or was treated with pesticides, or if you got an x-ray, that you will get cancer. Our bodies are different, everybody is different, and they each react to things in different ways. But being exposed to these and many other environmental factors can cause our guards to die, especially if you are exposed to them for a long period of time. And so these are the things that cause cancer. The uncontrollable division of our cells causes clumps of these bad cells, which are called tumors. As I said before, once the cell stops being able to control its division, more and more mistakes that ruin the function of the cell will happen, and these problems will be passed on to the daughter cells through these uncontrollable divisions until the cells in this tumor are completely unrecognizable as the cells they used to be. For example, if this was breast cancer, the breast cells would no longer look like breast cells, and they would only work to cause chaos and to turn good, healthy cells into more cancer, like zombies. And again, not all the cells in the breast would become bad. It would be in the tumor. Now, not all the tumors will lead to cancer. Cancer meaning that the bad cells will be so bad, they will cause their body to stop working properly. Some tumors are benign. These can often be removed, and in most cases, they do not come back. Malignant tumors will cause problems in our body. This is because malignant tumors will have cells that will travel to other parts of our bodies. In benign tumors, the bad cells stay within the same area and aren't so far down the zombie route that they are still recognizable as, let's say, breast cells. In malignant tumors, the cells are so monstrous and so unrecognizable that they just cause chaos, and they travel through our blood and our lymph nodes to other parts of our body, causing more tumors there. Once the cancer travels to multiple parts of our body, it is a lot harder to remove. And so why is it important for Latino communities to learn about cancer? Because 1 in 5 Latinos in the United States die of cancer. Cancer causes more deaths in Latino communities than heart disease, which is the leading cause of death in white communities. Latinas in the United States are diagnosed with breast cancer more than other ethnic groups. Latinos are also diagnosed with cancer at much more advanced stages compared to other ethnic groups when it is more difficult to cure. This is all because Latino communities are much more likely to be exposed to all the factors that promote cancer, such as unhealthy air, unhealthy diets, etc. And this is because Latino communities in this country are more likely to have low income and to live in areas that have poor air quality, to not be able to afford healthy food, to not be able to pay for health insurance, or to have access to the education that teaches them the risk factors for cancer and how to prevent it. That is why it is important for us as Latinos to understand that these are the disadvantages that our community has in this country, so that we can take control of our health and take the preventative measures that we can. Okay, so now we're going to talk about some specific facts about breast cancer. First, we want to say that it is not a sin to touch your breasts. You should try to get to know your breasts by doing breast self-exams. To do this, simply press around your breasts with different levels of pressure, looking for lumps, balls, or abnormalities. In addition to this, to find breast cancer, some tests that doctors perform to detect breast cancers are MRIs and mammograms. You'll hear about mammograms a lot. According to the American Cancer Society, all women over 48 years of age should have at least one mammogram as the risk increases after this age. Women between the ages of 45 and 54 should have at least one mammogram a year, and women over 55 should have at least one every 2 years. Another fact that we want to point out is that women with breast cancer do not lose their sexuality. This myth can originate from the fact that this cancer affects the breasts and can end in mastectomy, which is a surgery to remove one or both breasts. If undergoing a mastectomy causes any kind of emotional or personal distress, reconstructive surgery is always available, which is surgery that reconstructs the shape and appearance of the breast. In fact, the Women's Health and Cancer Rights Act is a law in California that says that if your insurance provides benefits for a mastectomy, it must also cover reconstructive surgery if you choose to have it. This is why it is important to discuss your options with your doctor before surgery. If for any reason this reconstructive surgery is not available to you or you do not want to have it, it is important to seek help if you're struggling with intimacy, sensuality, or emotional problems. Next, ignoring a lump in your breast will not make it go away. Breast lumps can develop in all women, and as we mentioned before, some lumps may end up not being cancerous. In fact, 80% of the lumps found in the breast end up not being cancerous. But if you find a lump, be sure to tell your doctor because only they can tell you if it requires further testing. You also do not have to go to a clinic or primary care office. You can contact public health departments, a family planning clinic, a hospital, or a breast cancer center near you, and they will help you get the tests that you need. You can also call this number here and they can help you get the resources you need. Next, talking about cancer is not bad. It is important to talk about cancer so that those with information can share it to increase the awareness and early detection of cancer. Not talking about cancer or being afraid to talk about it with our friends, family, and healthcare providers can be deadly since, as we mentioned, cancer cells can migrate to other parts of our bodies and become more difficult to treat. That is why it is important to detect it as soon as possible. Now let's talk about some myths and facts about how breast cancer can occur. One myth we want to clarify is that cancer is not contagious and can be treated. In some cases, cancer is hereditary, but we've already talked about how that doesn't mean you were born with cancer or that your parents gave it to you in the same way as the flu or a cold. It simply means that you were born with a higher chance of developing cancer. Some types of cancer can also be caused by viruses, such as the human papillomavirus and the human immunodeficiency virus, because viruses introduce mutations into our cells. But just because you are infected with those, that doesn't mean that you're going to get cancer. So that's why it's not actually contagious the way that a regular virus is contagious. Next, breast cancer is not caused by lesions to the breast. There is no scientific evidence to indicate that damage or a blow to the breast or other parts of the body causes cancer. As we mentioned earlier, cancer is a disease caused by the abnormal growth of cells that make up a tumor, and it can appear anywhere in the body. Cancer is also not a punishment from God, nor is it a death sentence. Since everyone is different, a cancer diagnosis can be received differently from person to person. If you're feeling very overwhelmed and having a lot of trouble emotionally, it is important to reach out to someone. Your mental health is just as important for your recovery as it is for your general quality of life. And remember, everyone has a risk of developing cancer, and cancer can be treatable, especially when detected early. Some common ways that we can interact with chemicals that can cause cancer are through cosmetics. Some cosmetics have chemicals that are hormone disruptors, which can cause problems in our body and cause cancer cells. Some beauty products, such as makeup, moisturizers, hair products, and shaving cream, also contain parabens, which are chemicals that have been linked to cancer. I'm not sure how to pronounce that word, but phthalates are other chemicals that have been linked to cancer and are found in things like nail polish, hairspray, and fragrances in personal cleaning products as well. As we have mentioned before, just because you use products that contain these chemicals does not mean that you will get cancer. All bodies work differently and fight differently, and our bodies are generally good at defending ourselves, but they definitely put you at a greater risk, especially if you use them for a long period of time. Breast cancer is the most commonly diagnosed cancer in Latinas. Breast cancer is also the cancer with the highest mortality rate among Latinas due to late detection and treatment. Latinas tend to have poor outcomes with respect to breast cancer due to various factors such as a lack of detections, late screening, fear of diagnosis, lack of English knowledge, health insurance, distrust in the healthcare system, fatalistic attitudes, lack of transportation, lack of free time, and family commitments such as taking care of children and elderly. These factors can be as a result of both cultural beliefs and practices and ethnic marginalization in the United States. Women of all ages can develop breast cancer, and in fact, men can also develop breast cancer, though it is less likely. More than 250,000 women under 40 years of age are living with breast cancer, so it is not unheard of. The American Cancer Society says that between the ages of 20 and 39, a woman should get a clinical breast exam at least every 3 years. Most women under 40 years of age are not eligible for mammograms, but if you have a family history of breast cancer, you should have a mammogram before age 40. Perform breast self exams every month and let your doctor know you have a family history of breast cancer so that they can take that into consideration during their care. Next, a healthy lifestyle can reduce the risk of cancer as many of our unhealthy habits put us in contact with the risk factors that can cause cancer. That is why it is important to exercise and maintain a healthy weight and eat more fruits and vegetables since they contain important molecules that help protect us against cancer. Smoking also introduces bad chemicals into our body that cause cancer, which is why quitting or not smoking at all is very important. Breastfeeding has also been shown to reduce the risk of breast cancer. And again, get cancer screening, especially if you find anything abnormal. Reducing your stress can also lower your chances of cancer or illness in general. Headaches, digestive problems, and anxiety are evidence of stress. Some ways to reduce stress are to attempt adopting a positive attitude, to read, walk, meditate, or make time to do something fun. It is also important that if you feel too overwhelmed, that you do your best to seek help through family, friends, support groups, or even a therapist if necessary. Support groups can improve the quality of life for cancer patients, survivors, and families. Support groups create an environment of support and understanding. It can help identify and reduce emotional trauma by reducing feelings of isolation and loneliness, as it allows you to hear the story of others who are going through very similar situations and have similar feelings. Support groups can also give you hope and self esteem by allowing you to hear the stories of how other people were able to overcome their situation. Our organization, Latinas Contra Cancer, currently provides the support group service. So if you are interested in learning more about our support group, let us know. You have our website link there, and thank you so much for watching this presentation. It's a great thing that you want to learn about breast cancer. Please let us know if you have any questions. You can email us. You can let us know in the comments, or just make sure that you are sharing this information with your family and friends. Share the video because it's really important to spread our awareness of cancer so that we can get more early diagnoses rather than late diagnoses for our community. Thank you so much for watching.